California once led the way in curbing the spread of the coronavirus. Now, the state has become a hotspot for COVID-19. As hospitals continue to battle an uptick in cases, so do a number of communities. I spoke with Dr. Malathi Srinivasan of Stanford Healthcare about whether it's still possible to bend the curve.
Thank you for having me, Michelle.
Well, we knew we could see an uptick in cases when the county started to reopen, but did you expect to see this sharp of an increase this quickly?
This is completely unsurprising. What we're seeing now is the result of what people were doing about 3 to 4 weeks ago. And we know that after 3 months of quarantining, people were getting restless and the state was starting to reopen. And at the same time, California being at the epicenter of much of the protest movement for racial justice, we were also seeing people come out. So we know that the virus takes about 1 to 2 weeks for people to become symptomatic. And after becoming symptomatic, it takes them another 1 to 2 weeks to become severely ill. So now that we're seeing an increase in the number of cases, just last week, we had about 4,000 beds in California, hospital beds that were taken with COVID patients, and 1,300 ICU beds. That's up 600 beds since the previous week. So what we're seeing now is what happened a month ago, and I think we're all expecting to see the numbers to increase over the next few weeks.
At this stage, with so many new cases, how difficult is it to control the spread of COVID-19?
Michelle, I'm an optimist, and I know that the genie is definitely out of the bottle, but I think we can put it back in again. I think that if we just go back to the things that we knew bent the curve in the first place, so the three biggies, of course, wear a mask, wash your hands and don't touch your face, and the third is socially distance, we'll be in very good shape. The other very new important thing for everybody to do is, as much as humanly possible, avoid any indoor activity with people outside of your immediate circle of trust, your family group or your very close friends who you've been sheltering in place with. So we need to go back to sheltering in place, and we need to do it as aggressively as we did initially.
Gilead recently priced the coronavirus treatment Remdesivir at about $500 per vial. How exactly does Remdesivir work?
So remdesivir is an antiviral, and it works by stopping viral replication. So what it does is it incorporates itself into the virus as it's replicating, as the virus is replicating, and stops replication in its tracks. So usually a couple days after someone gets remdesivir, you start to see the viral count start to go down a lot. Now, a treatment course is 6 vials or 5 days of treatment, so 2 the first day and 1 on the next couple days. So it's about $3,000. It's only available, as you know, to people who are hospitalized. It's not an outpatient drug. It's for after you get pretty sick. And we know that remdesivir also drops the death rate for hospitalized patients from about 12% to about 8%, and it shortens the total duration of illness. So it's an effective medication. It's not a magic bullet, but we know that it's effective, and it's one of the first things that we had as an arsenal in our inpatient treatment. The second one being now some of the steroids you can use when someone's on a ventilator, but those are only for ventilator patients, not for early treatment.
Do we know more about coronavirus tests and how accurate they are?
Michelle, I think that all of us have questions about how much we can trust these tests. And if it comes back negative saying that we don't have a test, does that mean we actually don't have the test or just didn't pick it up? There's two different types of coronavirus tests. The first one looking for active infection, and the second one looking for infections that you've had in the past. And those are the immunoglobulin tests. So the active infection tests are the ones that are most controversial right now because the accuracy really varies. It varies in 2 ways. One, depending on the type of test that's run, and second, on the collection and the method of collection. So currently, the best test that has over a 97% sensitivity, meaning that it's likely to pick up the test if you have it, are the deep nasal lab-based PCR tests. Now, those usually take about a day or two to come back, although the tests only take an hour to run because you've got to collect it and send it to the lab and then get the results back. Kind of in decreasing order of sensitivity are things that are the mid nasal swabs that people can collect themselves. And then the least sensitive are the ones for saliva and the ones for the throat samples. So, when should you use the other tests that are not the lab-based tests? I think that under a couple circumstances. The first is if the lab-based testing is not available. The second would be if you're planning on doing a test and retest, so you're testing serially, because the more you test someone, the more likely, who is infected, the more likely they are to have a positive test. The codicil to all of this is that all of these tests were developed on people who had symptoms. So we actually don't know how sensitive it is when people are earlier in their infection, or if they don't have any symptoms, in terms of the will it pick it up if you actually are infected. So the message for the active testing is that be careful in how you interpret the results. And just because the test comes back negative, especially for the less sensitive tests, which are probably have a sensitivity, we think, somewhere in the 80 to 90 percentile. So it's going to miss a fair number of infections. Just be careful how you interpret it, and still continue to shelter in place and follow best protocols. The immunoglobulin-based testing, which is looking for prior infections, is pretty good after about a month of having been symptomatic. So if you had a prior infection, about 20 to 30 days afterwards is the right time to get the immunoglobulin tests. What's new in testing is actually three things. The first is people are doing a tissue-based testing, and there's some assays that are being developed for that. The second is a test to look for dead versus live virus, because right now the PCR molecular test for the active infection just picks up viral particles, so we don't know if they're active or not, or your body's killed them and it's still being cleared. And then the third thing is what's called pooled sampling. So one of the most challenging things right now is that we're running out of reagent, and we're running out of test kits, especially as the country starts ramping up our testing processes. So we need to find ways of conserving tests. And one of the ways of doing it is to take, say, 4 or 5 people and pool all of their samples, run it. And if someone comes back positive, or if the test comes back positive, then you run the individual samples. But if the group comes back negative, then you've just saved yourself, say, 4 or 5 tests. So you can test more people and more samples. And that's very good when the prevalence rate's low. When the prevalence rate starts to go up, it may not be as useful as a way to conserve tests.
And Dr. Srinivasan, before we wrap up, is there anything else you would like to add?
I think the main thing is that as a state and as a people, I think we have to come together to protect each other. I think that this is the opportunity for all of us to show that we care about our health and care about the health of our communities. And I think we need to go back to doing the social distancing that bent the curve in the first place. So my plea, and I think of all medical professionals to everybody in our community, is please take care of each other, take care of yourself, socially distance, and don't do activities indoors.
Dr. Malathi Srinivasan of Stanford Healthcare, thank you.